When Dr. Moore case came about, I think it just really inspired and really made a super reason for the legislation to take place.
Around Christmas, the world was reading about an Indianapolis doctor who died of COVID-19. When Dr. Susan Moore was initially hospitalized with the virus, she shared videos detailing her treatment experience, accusing a doctor of not taking her pain seriously because she was black. Throughout the pandemic and the push to address systemic racism in the United States, healthcare systems have been pledging to address racial disparities. WRTV's Cornelius Hawker shows you how a state lawmaker hopes to help.
State Representative Robin Shackelford is working to address one of the many issues that contributes to health disparities faced by minority communities.
Legislation will require health professionals to get 2 hours of cultural diversity training.
This training will be designed by the Office of Minority Health along with the state health department, ensuring people of color have input. If the legislation becomes law, the training will be mandatory for medical professionals.
There's accountability in it because if you don't have your completed training certificate each year, you may not get your license that you need to get renewed.
This proposed legislation came about because of COVID-19's disproportionate impact on communities of color here in our state. Some of those disparities, Rep. Shackelford says, are caused by medical professionals not knowing how to talk to their minority patients.
Minorities feel they're not listened to by their healthcare staff, by their doctors. Sometimes they feel like they're talked down to. If they ask questions, they're getting very intimidated.
To make sure those experiences are being addressed, the legislation would also create a database to document cases.
What this will do will create a statewide requirement that we are actually collecting data of patients' experiences based on their race, their religion, their sex, their sexual orientation, their disability status.
Representative Shackelford says this legislation, with all it would do, is one more step to fixing the ever-present problems plaguing our state when it comes to minority health disparities. Working for you, Cornelius Hawker, WRTV.
The bill has not been filed yet. Representative Shackelford tells WRTV it's still in the review process, but once it is filed, she urges you to reach out to your legislator if this is something you want them to support.